Welcome to this latest edition of 12 Health. My name is Shannon Heggie, and today we are discussing the results of the U.S. Pointer study, which we've been telling you about for months now. This is a study about Alzheimer's to evaluate whether lifestyle interventions targeting risk factors protect cognitive function for older adults who are at high risk. And to talk about this study is Dr. Stephen Salloway joining us over Zoom. He is the principal investigator of the New England RI site of U.S. Pointer, as well as the founding director of Memory and Aging Program at Butler Hospital and a professor of neurology and psychiatry at Brown University. Dr. Salloway, thank you for joining us.
Thank you for having me.
And also joining us is Linda Petras, a 78-year-old study participant from Providence. She was part of this Pointer study. So thank you both for being with us. I know these results came out on July 28th. That's when they were announced. But I really want to go into what those results mean, what this study was all about, so we can really give our viewers a sense of how big this is in the world of Alzheimer research. So this was the first large-scale randomized controlled clinical trial to demonstrate this. Dr. Salloway, this is huge, I would imagine, because it's not even talking about medicine and pills and things like that. This is about lifestyle changes, right?
Well, first of all, this is a landmark study, and we're so excited that we brought it to a successful conclusion, and the results are positive, which we'll go into. And I want to give a huge shout out to Linda and all the study participants here and around the country, and especially those in southeastern New England and Rhode Island who made this possible. It's just a huge effort. All through COVID, we did the recruitment and much of the intervention, and people showed up, and it's really a big accomplishment. So Linda, I hope you feel really proud of what you did, you and all the other participants at our site and around Pointer.
Linda, you're getting a little emotional at Dr. Salloway's words. Can you kind of give us a sense of why you felt you needed to take part in this study?
Yeah, thank you, Dr. Salloway. It was, as I was mentioned, I've worked in biomedical research for a long time, and I was able to retire a few years back. And now I have an opportunity to give back through various medical studies. I've done some through Boston. I'm part of the ARIAS 2 study, which is also through the Alzheimer's Association. And, this family history. Fortunately for my mom and her mom, it didn't set on until she was much older. But there's a family history, and if there's anything I can do that'll help find some way to reduce the incidence or slow the incidence, maybe that's more what we need to do right now, is slow the incidence, then I'm more than happy to be involved with any of the studies.
It's a beautiful thing you did taking part, Linda. Thank you. So Dr. Salloway, let's get back into, this was specifically about lifestyle changes. We're talking about diet, exercise, heart health, and something called cognitive challenge. Can you kind of explain that for the people out there watching?
Yeah, so that's what's so important about this study, is that it looks like more than 40% of the risk for Alzheimer's and dementia is modifiable, largely through lifestyle interventions, like the ones you just mentioned: exercise, Mediterranean diet, heart health especially, brain training, keeping your brain stimulated, socialization. And doing all these things, we were testing that. In 2,000 people, there were two groups that participated. Linda was in the structured group that got lots of coaching and guidance and support, a free membership at the Y, and were closely monitored and carrying out all these activities. The second group was self-guided. They got some education. It was much more informal, and they had to do it on their own. And both groups improved on memory testing after 2 years. These were people aged 60 to 79 who were at risk, had a number of risks for Alzheimer's, family history being a large one, not being very active physically, not eating a good diet, a healthy diet, and having other risk factors for heart disease. And so they were cognitively normal. They didn't have signs of Alzheimer's at the moment, but they were at risk of developing it. And we wanted to look at memory performance after 2 years. So both groups, the good news is, got better. So by doing this type of approach, you can improve your memory. If you get more structured, more coaching, and more support, like Linda got, that group does even better and probably saves an extra year or two of cognitive health and builds up more resilience against cognitive decline. And so this is something we all can do, and we can start it early. And we're so excited about this outcome. And now the Alzheimer's Association, which supported the trial and also helped conduct the research. This was a new venture for them. Not only did they provide the fundraising, but they actually hired staff to help navigate the different groups to make sure that the trial was successful. And they have committed to rolling out the results into the community so we can apply it more broadly.
So Linda, hearing Dr. Salloway explain what it was like for all the study participants, take us through what maybe an average week was like for you compared to the way you were living before you joined the study.
I mean, I was active to some extent, but the major thing that improved for me was my diet. I was not very good at leafy greens, and I was not very good at all with olive oil. And just changing relatively minor changes in my diet, adding more nuts, adding whole grains I was good at, and staying away from sugars, again, which I didn't eat a lot of. And I find now if I don't eat my greens, I feel guilty. And I have to run to the store and get a package of premixed greens and have it for dinner. And then I also getting more active again. I had been active. I had been issues with my knee. And then COVID hit, so I couldn't get to the gym. But we had to document. We had to have physical exercise. We had to have stretching regimes. We had to have weight-bearing regimes. And it all had to be documented on forms along with our diet. And along with these brain games we did through the computer. And I mean, I love structure and I love doing all the data, but it was like, okay, I haven't done my brain games. I haven't gone out with COVID, I couldn't go for a while, so I would go for a walk, or I would ride around the neighborhood. I live on the east side, and I would say, I got to ride, I got to document it, if nothing else. And I found that just even with the diet, I don't have any incidence of diabetes, but my A1C, which is the long-term measurement for blood sugar, dropped 5 points. So I'm healthier now than when I started.
I bet you can feel the difference, too.
Yeah. And I've gone through a knee replacement recently, and just being able, I think the 2 years where I really worked on the study, it's like, yes, you have to exercise. You have to exercise. You have to rehab the knee. And then because I was exercising during the study, I could rebuild the knee faster.
Yeah, you bounced back probably quicker from surgery.
Yeah.
What was your reaction when it came to testing your memory at the end of this study and seeing the results and seeing what happened after all your hard work and sticking to this regimen?
It was just, I was just smiling. I was sitting with a friend who was in one of the unstructured groups, and we were just sitting there smiling. And it's like, yep, all those Brain HQ games I did. I can hear him laughing.
Shannon, this is a big commitment. Everything that Linda's talking about.
Like it. It sounds like it.
But yeah, and it's like, yes, whether I get a year or two extension, it's like right now there's a change, and doing all this work and being structured and having meetings and having to go through Zoom a lot of times for our meetings, and then meeting in person, and the support of the different navigators in the system was really helpful. And it's like now it's just like, okay, like tomorrow I'm going to go ride, then I'm going to go swim, then the next day. And it's like really reaffirming my commitment to take care of myself. Because I live alone, so I have to take care of myself.
Yeah.
And I've got good support, but also enjoy
That's
it.
the thing, Shannon, that I heard the most from the participants, especially the ones that spoke up in Toronto at the time the results were presented. They had one person from each group. And they said, both of them said, and sort of like what Linda's saying, it was like life-changing in that it gave them the structure and the support to really focus on their health and make changes that they might have put off. And some people, it sounds like Linda was in an intermediate group, but some people really weren't living a healthy lifestyle. And this was something new for them. And they were able to turn it around. That's where the structure, I think, comes in and really helps.
Well, we have only scratched the surface of this study so far. We're going to take a quick break. We want to come back and talk much more about what these study participants experience, the results, and what it means for the future of Alzheimer's research. We'll be right back after this. Welcome back to this edition of 12 Health. I'm Shannon Heggie, and today we're talking about the U.S. pointer study that was happening right here in Rhode Island to look at the ways lifestyle changes can slow cognitive decline and have a real impact on people's health. And joining me are Dr. Stephen Salloway, who was the principal investigator of this study, as well as one of the participants, Linda Petrus from Providence. Thank you again both for being with us. So before we went to the break, we were talking about all of the things that participants had to do in this study. And that was a Mediterranean diet, that was cognitive challenges, that was exercise. Dr. Salloway, these are things that we've been telling Americans to do for years, trying to get them to live a healthier life, trying to get them to exercise and be healthy. How far does this go, showing people that there's actual, real results?
Well, I think it's a great step forward. It started in Finland with the finger study, where they did a similar trial, lifestyle intervention for people at risk. But Finland is a lot different from the United States. It's a lot more homogenous. They eat a different diet. They have a different culture. And so we wanted to see how well, if we could build on that and see how well this would work in the U.S. population, especially a diverse U.S. population. And we recruited people from all backgrounds in this study, which we're really delighted about, from around the country. And it works well. It works similarly as it did in Finland. And that just gives us more evidence that all the things that we've been talking about, I mean, it's such common sense,
Right.
Exercise, diet, brain stimulation, being engaged with other people, heart health. I guarantee you, if we keep our hearts healthier, our brains will be healthier. And our whole goal is, as we're all living longer, we want to have our full mental faculties all the way to the end.
Right, because we've done...
So
Oh, I'm sorry, Dr. Salloway. I just wanted to, I watched, Mike Montecalvo's done extensive study or interviews with you about the studies regarding Alzheimer's research. And in those 12 on 12 digital originals that, by the way, you can see on WPRI.com, we have heard heartbreaking story after heartbreaking story of what it is like for people, for loved ones of those going through Alzheimer's. And when you talk about ways to live longer and to live better, living longer, I mean, that's just got to give hope to so many people, especially those like Linda, who have a familial history of this.
Absolutely. So I think we're entering a new era for treatments that promote brain health, and this is going to be part of the prescription. And these initial results are just the top line results, the tip of the iceberg. The participants like Linda, many of them, the study was sponsored by the Alzheimer's Association, $50 million commitment. The NIH, I think, put up a similar amount to get brain scans and study sleep and the bacteria and the gut and the cardiovascular system. And there's going to be all kinds of data coming out where we can pinpoint what treatment, what lifestyle intervention is going to work best for which risk profile. And most people in the study have agreed to stay on for another 4 years, where we can follow and look at the long-term outcomes.
Yeah, I was
So
going to say there's some $40 million, I guess, to do that, to study these participants and to bring these interventions to communities across the country. Because I was going to say,
that's
one
what
of the
I'm so
hardest
excited
things...
about. So anyway, there's a lot more to come. So your viewers should stay tuned. This is just the very top line. And the real challenge is going to be, how do we now roll this out in the community and implement it more broadly?
That was going to be my question to you, because you speak as though this is a prescription. And for a lot of people, regardless of your age, it is hard to exercise. It is expensive to eat healthy. It is, or they don't have the knowledge to do that. So do we have to rethink the way we get people to do this?
All of the above is true. There are real challenges, but there are real opportunities also. That's what we can build off of with these new results. We just have to figure out, it may not be exactly the same as we did it in the trial, but I guarantee you, I said it just a minute ago, if we keep our hearts healthy with keeping blood pressure and cholesterol and blood sugar and smoking and weight all these things under control, we're going to be healthier. Our heart will be healthier and our brain will be healthier. There'll be less Alzheimer's and less dementia. So that's something we all can do. That's what primary care medicine is directed toward. And so we can all do that. And then, we're all busy in various parts of our life and have challenges. So we have to figure out how to fit in the exercise and the diet and the stimulation and the support. I think the initial things, there are planning grants that are underway, and the New England, Rhode Island site will be part of this. We're really excited, where we'll be planning the implementation of Pointer in the community. So going beyond this study. And
Linda's excited. She's smiling right now.
Well, that's great. Yeah. Well, Linda, we need your enthusiasm to keep going.
I'm here.
Thank you so much. Okay. But how do we bring the coaching and the support into the community? Well, first of all, we have great YMCAs in the United States. So that's one resource. Plenty of other gyms and fitness centers and trainers. And we could train people up to become coaches. And maybe we'll have larger groups. Like Linda was in a group of the groups would tend to be 12 to 15 people, but maybe we'll have larger groups where you'll have a coach follow more people to make it more cost effective. So there's we have to figure out how to be creative.
It sounds like that coaching, though, almost like the way you had the two study groups, that one was structured and one was less structured. I would think that for anybody really trying to implement something that they've never done before, structure is crucial. And instead of medicine, and I know there are a lot of studies also in Alzheimer research where drugs have been crucial in the fight against Alzheimer's, but this is a great first step that doesn't involve medicine. It involves lifestyle.
Exactly. So, yes.
Making that a prescription. Making that a prescription, this new way of thinking, this new way of living, and this new way of preventing.
But you're right that I think, and Linda said it, and all the participants that I've heard speak about their experience have said the same thing, is that the structure and the support is so helpful when you're undertaking something like this. You're not on your own.
Yeah. Linda, when you
got a team there.
Linda, when you think about everything you went through, you did have that structure, but for the people out there watching that maybe are thinking like, I want to do this, I want to prevent, Alzheimer's and dementia, but I don't know if I can do that. I don't know if I can handle all of this new stuff, whether it's healthy eating, whether it's learning about different kinds of food, whether it's exercise. What would you say to those people out there to encourage them that it's possible?
Yeah, that's a great question. I was just thinking, when we started with the structured group, we focused on one step at a time. It was I think they started with diet, get more greens, get more olive oil. And then we worked on that for a month. And then they rolled in exercise. And they kept saying, if you get together with a group of friends, go to the Y together, go pickleball was big, go do something with a group. And then they would roll in another phase. I never realized, listening to the radio, I listened to NPR radio a lot, and it's like, yeah, I'm engaging my brain without really thinking about it, because I've learned things. And then they would add another piece, and not like, okay, you got to do all the stuff all at once and document it and be very good at it. It was like step by step by step.
So it wasn't too overwhelming.
Right, and that really helped phase in and work with everything that was happening. I loved it when the brain games came in, and that was later, but yeah.
Yeah, tell us a little bit about
that was Linda, when I heard that was the hardest part.
Yeah, we had a lot of differing opinions about how well that worked.
Can I
enthusiasm.
Crossword puzzle count as this, or are we talking about something much more involved?
It's a computer game. I'm not sure. It's called Brain HQ, and it has been vetted by various, I think, some military organizations for like brain rehab, and it's about a dozen different computer games that focus on activating different parts of the brain. Like they would show 5 mushrooms on a field, and then they would close off, and then they would show 6 mushrooms, and then you would have to pick out which is the new one.
Oh, okay.
And then there was another one where they'd have birds flying in a circle, and which is the different one, and or follow balls around in a circle, and they were all different types of activities which stimulate different parts of the brains, and then you could watch your progress over time because you'd be age matched. And for me, I love that stuff, and I've got more data than I was required to have. But
But it's instant gratification to
Yeah.
see progress.
right, because and for me, I loved it, and it's like, oh, what I did find notice is that certain games I'm not good at. My brain just is not. But it's like, well, what can I do to make it a little easier for me? And again, maybe in structure groups, somebody would have an idea. Oh, how about trying this? But it's like, okay, if it was rewiring my brain in a fun way.
Yeah.
So
That's great.
And I still have access to it, which I enjoy.
Yeah, it sounds like you enjoy it. Dr. Salloway, we've seen in a lot of Alzheimer's studies, and I might scientifically say this wrong, so correct me, but that the plaque buildup in the brain is really what starts Alzheimer's and dementia and is really what causes that, correct? So how do these lifestyle changes kind of pause that?
Okay, that's a great question. And we're
way that
going
makes
to have a lot. Well, I don't know. I actually don't know the answer to that yet.
Okay.
But we will have a lot more data about that because we have been able to get amyloid PET scans before and after treatment, and tau PET scans and MRI scans on people, on at least half the participants. So we're going to have a ton of data about that.
Okay, we're going to take one more quick break. Dr. Salloway, I apologize to interrupt. We're going to take one more quick break, and we'll be back to kind of wrap this all up and talk about what's next in the world of Alzheimer research. Stay with us. And we're back with this edition of 12 Health, talking about the results of the U.S. Pointer study conducted right here in Rhode Island. And Dr. Salloway, before we went to break, you were talking about that there's going to be even more data coming in about how these lifestyle changes help with the plaque buildup that we've learned through much Alzheimer research is what really causes this disease.
Well, my view is we all should be pursuing healthy, promoting brain health and starting as early as we can in life and keeping it up. Having good health habits are going to keep our heart and brain healthy. Some of us are at higher risk of Alzheimer's, and we should do that. Those people should do that too. But it may not be enough because, as you say, they're still destined to build up the plaques and the tangles that will eventually cause the memory loss of Alzheimer's. And so those people who are at higher risk are probably going to need additional treatments that target the plaques and the tangles and doing that early. Mm-hmm. We hope that can be combined with these kind of lifestyle interventions to get the biggest effect. And so that's on the horizon, which we hope to pursue. And one thing one really exciting outcome of the finger trial and now US Pointer is that there's a whole movement that's been developed called the Worldwide Finger Movement. And these studies that, like US Pointer, are being conducted in more than 60 countries and 6 continents now. So it's really taken off. And I think it's something we can scale because, as you say, it doesn't involve medication or infusions or expensive drugs. So I think it's something that we can learn how to implement, hopefully across the world, and tailor it into different cultures.
Well, I certainly look forward to seeing the follow-up to this study as we continue following the participants, and Dr. Salloway, as you continue showing us more results from all of these studies. I know with all your talk, the word hope keeps coming up, and that's a big thing for everyone in Alzheimer's research and everyone with family history of this disease. And I think this study just furthers that hope, and that's a great thing. And I want to thank you, Dr. Salloway and Linda, for being with us on 12 Health today. And again, if you want to see more of our Alzheimer's coverage, The Battle Continues, which was a Murrow Award-winning segment, we have that on WPRI.com from 12 News anchor Mike Montecalvo. Again, thank you.